that
Okay, so the next session is the winner of our poster competition, and I'd just like to ask people to start thinking for next year, because we obviously will do this again next year, and to put your, get thinking about your projects that you might want to submit. But this year's winner is Rahab Hashim from the University Hospital of Bristol and Western NHS Foundation Trust and King's College London, and her project is on sexual dysfunction in premenopausal women with type 1 diabetes. So welcome up to the stage and congratulations.
I didn't even realise. How lovely. Let me just carry that away. Thank you very much. Oh my goodness. Do you know, I am so grateful to the DSN Forum. I'm coming just to present my work. I thought I'd just put an abstract and see, just to raise awareness, and then to come and present in front of 250 or more people, and then win. Honestly, I'm so glad, and Angus will be very happy. He will have an email of that. Thank you very much. So I am Rahab, diabetes nurse at Western Hospital, University Hospital, Bristol and Western, NHS Foundation Trust, and I'm also I said to Beth, third-year PhD students, but actually I've just entered my fourth year, so funding for 3 years, but now I am in the write-up phase, so hopefully to submit within the next 6 months. I feel a bit like, I didn't realize I was going to win, so it's nice. I know I was going to present, but I didn't realize, so it's nice of you. I think yesterday the presentation from Rose and Becky about research and about the story of my life over the last 3 years. And I think you mentioned about ethical approval and how long it takes to get ethics. And for me, we had a debate the other day with PhD students, which is harder, getting ethical approval or is it getting participants? And I think getting participants is way harder. With ethics, you could just wait time and fill in this statement and things, but with getting participants was so hard. So really, I'm grateful to you guys. You retweeted, you shared, you did as much as you can, and you've got me some participants, whether it is women with type 1 diabetes or it was healthcare professionals. And also, where is Dawn Adams? Dawn, I need to give you a hug. This woman, if you are doing any subject around women health and diabetes and menopause, she just said to me, I'm going to put a post on Facebook group of women with type 1 diabetes, and she said, get ready because you're going to get lots of emails. And that day was the best day in my research life. I was so happy replying to emails. I wanted 15 for this phase, and I ended up with 80 emails on that day. And I was, for the first time, saying to people, look, I've got enough people, so I'm going to get back to you if I need you. So DSN Forum and Dawn, you will be mentioned our final paper, hopefully we are working on at the moment. So the project title is, well, this is the overall title, Sexual Dysfunction in Premenopausal Women with Type 1 Diabetes. But the presentation is about the qualitative aspect of this study. So we've done, obviously, the project over 3 years, many studies included in this project. And as a background to the subject, we know the prevalence of diabetes is increasing rapidly. There are about 415 million people with diabetes worldwide. And type 1 diabetes accounts for about 10% of this total number. And with diabetes come the complications, microvascular and macrovascular complications. And there's also the psychological morbidities. And female sexual dysfunction is one of these complications that hasn't really been fully studied. I think if you talk about male sexual dysfunction and erectile dysfunction, we've got treatment pathways, we've got some knowledge about it. But in female sexual dysfunction, there's hardly anything. And I think the reason I've chosen this subject to study is because I was asked about it in the clinic, and I didn't know what to say to the woman who asked me. So, and I still feel like the resources are very limited. And that's because there are so many factors to it. It's not just biological. There is the psychological, there is the social aspect of it, and there is living, obviously, with type 1 diabetes. So what is different about sexual dysfunction in women with type 1 diabetes? Type 1 diabetes affects women at reproductive age. The mean age of the onset of type 1 diabetes is 29 years. And neuropathy, which has been linked to sexual dysfunction, starts early. Some studies suggest that it starts 6 years before the onset of the disease, and some studies suggest that it starts 13 to 14 years after the onset of the condition. And the prevalence of hypoglycemia is high in people with type 1 diabetes, and that's because of the treatment with insulin. And hopefully with the use of the hybrid closed-loop system, and that will reduce the hypo events. But again, with the technology, there's more and more research coming about the impact of diabetes technologies on the women's self-confidence. And about the alarms and all that we've heard about yesterday and today. The main thing really, there is no diabetes-specific tool for measuring sexual dysfunction in women in general. There is a tool that is generic, that has been used, but there's nothing to address diabetes factor related to the women's sexual function. So the aim of the study was, this part of the study, the qualitative aspect, to explore the women's experiences of sexual dysfunction, to develop a framework, to develop a questionnaire, an item bank, basically, based on the women's experiences. The study design here followed established method of patient-reported outcome measure, the Cosmin criteria. I said 4 phases, but it's actually more than 6 phases. We started with a literature review, which we published in the Diabetic Medicine, and we looked at the prevalence of sexual dysfunction in women with type 1 diabetes compared to women without diabetes. And women with type 1 diabetes have 3 chances of developing sexual dysfunction compared to women without diabetes. And the second phase, we looked, and this is what I'm going to talk about, the qualitative interviews. And then after that, we've developed an item bank, some questionnaires from the qualitative interviews and the factors that we found from the literature review. And we've developed, I think, 30-something questions. And we took it to focus a group of women with type 1 diabetes and another focus group of healthcare professionals. And we refined the scale. We've done some modification. And then after that, we took the test online to recruit women with type 1 diabetes. And this time, we've recruited about 149 women. And this time, the women were able to give us feedback about the questions, which questions were important to them, what they want us to do. So again, we refined the scale, and we went, the next phase was actually doing cognitive interviews. And if you don't know what cognitive interviews is, it's just basically asking women, this is when I needed Dawn, and that's what I wanted. I wanted to do 15 interviews, and then asking the women to repeat the question in their own words. What does it mean to them? Did it make sense? Are the answers applicable or relevant? And do they want us to change anything? And at the same time, I was observing if it was like delay in response and things like that. So all this data we collected this data, and then we modified, the research team modified the scale again. The final testing, we've discovered there is a digital recruitment company that they do, I don't know if you heard about Native Healthcare Research, and they can recruit for you. And they did, this was another amazing thing really, because I aimed for 300 participants for the final phase of the PROM development. And we ended up with 918 women answered that survey in about 4 weeks. We meant to have it over 6 weeks, but because the response was so amazing, we had to close early. So then we've got a massive set of data at the moment we are analyzing. 44 of the women who respond to us in phase 4, we asked them to retake the test, just to see 2 weeks after, is it still making sense to them? Are they giving the same responses, basically? And that's for reliability testing. So the inclusion criteria throughout our study were for women with type 1 diabetes who had it for more than 1 year, aged 18 to 50. And this 50 years created a bit of, even when I had an exam at King's, why 50 years, And the reason we chose 50 as a cutoff is because of the menopause, which has been linked to sexual dysfunction. So we wanted the focus to be on diabetes rather than any confounding factors that could take it away from the could take the focus away from the research. We wanted to include women who are sexually active, so we've included 3 screening questions. And if the women answered positively, do you feel any anxiety, or do you feel any discomfort, or 3 questions. If they answered positively to any of these questions, then they were included. We wanted, again, if the women are sexually inactive for any other reason, then we would exclude them as well. And obviously women who are able to communicate in English, and women who are able to provide an informed consent. So we've included 18 women. This study was published in the last, I think, 10 days in the Diabetic Medicine as well. 13 were from NHS participants between Bristol and Weston. And then we wanted to allow more women to take part, broader participation. So we went online and we've recruited from social media platforms, and this time we had 5 participants. So these are the characteristics of the participant, the age within our criteria, and the age of onset of diabetes. Interesting, with the duration of diabetes is the same, that was coincident, and the HbA1c ranges and the BMI. So the themes that were identified from this qualitative study, and I will go in a bit more details in the next slides, initiation of sexual activity, and sexual confidence, and enjoyment and engagement, and sexual desire. The first theme, initiation of sexual activities. Women talked about fear about initiating sexual activities with long-term and new partners. They talked about fear about the impact of their glucose levels on their ability to initiate sexual activities, and also about internalized stigma, meeting new partners and whether disclosing they've got diabetes. One of the participants said, you can't let go 100%. You've always got to think, is that going to affect my sugar levels? Erratic sugar levels play a part, because if my sugar levels are low, I can be very emotional. And if they go high, I can be very irritable. So emotionally, that has an effect, because I don't particularly want to be with my husband. The second theme is sexual confidence. And the women talked about body confidence and the related things like injection sites and the impact of visible diabetes technologies as well. It keeps coming up in different forms in terms of how women express their concern about the diabetes technologies. One of the participants said, I just always felt like a little bit nervous and insecure about having my infusion set on display during intimacy. The third theme is sexual enjoyment. The women talked about their sexual things that affected their sexual pleasure, the physical, and they meant to make sure about the physical and emotional impact of diabetes on their ability to enjoy sexual activities. And they talked about, the impact of their glucose level, glucose variability, high and low blood glucose level, and the impact of diabetes technologies was mentioned again in terms of the dislodging pump or the alarms and things that could interrupt their sexual enjoyment. One of the participants said, but it's always worse when we are in the moment and the alarm goes off or something, because he just freezes. It doesn't ruin the moment completely, but it does stop it enough that everyone has a little chat. The fourth thing, I know. Sexual engagement, and again we see the impact of glucose level. There's more details. I mean, I can't see my notes here, but there is more in the study as well, and it is open access if you want to have a look. The physical implication of diabetes, and again the technology came again in different forms. So it says, one of the participants said, the pump definitely has an effect, because you are constantly worried about where it is. I mean, I know from previous sexual activities before it has fell out. And the final theme, the women talked about sexual desire. And here, some of the women could relate this to diabetes, and some didn't know whether it was just general lack of desire because of, life event and being busy and all that. Some of the women said, just because of my glucose level, I don't feel like the same like I used to be. A quote here from the participant said, there is no desire there. And it's not just because I'm not attracted to my partner. It's just the way I feel, and I am trying to avoid it. And I think it's become apparent that I'm trying to avoid it. which is causing a few issues. So based on the literature review and the qualitative interviews, as I said, we wanted the questions to resonate with the women. We want it to be as user-friendly as possible. It was actually the items were developed keeping the same language as much as possible as well. These are examples from the questions, and I like sexual desire because of my diabetes, this first one. And then the answers will be always, sometimes, occasionally, and then we'll calculate the score. And at the moment, we are working on the analysis of the data to look at the scores. And then, early analysis showing that probably women with longer duration of diabetes had higher sexual dysfunction, but obviously we'll publish all the findings hopefully soon. I just wanted to mention the research team. If any one of the DSNs or any diabetes professional want to do a PhD, I was very lucky. I work with the most amazing team, honestly. Nobody's here. I wish they are here. And that makes it really exciting. Yes, it is difficult. You were saying about research and why do we do it? I'm sure you will do it again, and I will do it again, and I will go to ethics again. I think that makes it a lot easier when you work with people who are really motivated, with amazing people, with a group of people. Professor Angus Ford, he's the lead supervisor, and then Dr. Rita Ford and Judith Parsons from the UK. And then from Italy, we've got a team, and hopefully once we finish with the scale, we could think about our next project, maybe translation to Italian or something like that. Professor David Ozili and Maddalena Di Maria as well from Italy. Thank you very much for listening. And if you fill in a questionnaire next time, please do think, now I'm thinking differently, because the time it takes to come up with a questionnaire is not just, as it sounds. Thank you.
Thank you very much. So thank you to everybody that submitted posters for this session. But I'd like to congratulate Rahab for her poster presentation.
You are a star. Thank you very much. Thank you. Yes, bless you. Thank you.
Oh, me as well.
Yeah. Thank you.
Was there any questions before we let go? Was there any questions on the Slido or?
Nothing on Slido.
No? Does anybody have any questions that they'd like me to run to anywhere? No?
No, thank you.
No? Fantastic. Amazing. Thank you very much.
We need some furniture removal going on.